I'm here gathered with this group of you are all men who want to quit smoking, is that right?
Yes.
Right. You guys can do it. I believe in you. I believe in all of you. So we're going to learn a little thing or two about, smoking and then what can happen as a result of that and then things to look out for. Okay? Here are some of the negative effects of smoking. Going blind. You have glasses. How would you feel without those on?
Fine.
But like less seeing, that's right.
Yeah, a little bit less seeing.
Hey.
I'll take one.
No, keep going. Type 2 diabetes. You have that. Erectile dysfunction.
Problem.
Ectopic pregnancy. Hip fracture. Colorectal cancer. Rheumatoid arthritis. Cleft lip and cleft palate. In your children, not you guys, but your women, your wives. Fertility issues and gum disease. So these are all just some of the random things that I was able to learn about that are negative effects. Next, I'll have the positive effects of smoking. You'll die earlier, so you don't have to worry about BPH or glaucoma. So that's nice. Also, you'll have erectile dysfunction, so you don't have to worry about STDs or anything like that. So, you guys get it?
You don't, huh?
I like that fun. All right, so that's what we have for that. So don't smoke because there's no positive effects of smoking. It's bad for you. All right, COPD can be caused by smoking. Okay, so COPD is a group of disease that causes airflow blockage and breathing-related problems. It's made up of emphysema and bronchitis, and then asthma in some cases. But those are the two main ones with COPD. Do any of you guys know how the lungs work normally? It's okay.
Air in, air out.
Air in, air out. I like it. I like your moxie, sir. What's your name?
Wilfred.
Wilfred. I like your moxie. So normally when you inhale, the air just moves through your trachea. So this is your trachea, and it moves down your two tubes called the bronchi. And then there's little sacs called alveoli on the bottom of that, and so those fill, and those have tiny blood vessels running through them, and the oxygen goes to that. So those are called capillaries, those little blood vessels. And so the oxygen goes from the capillaries into the bloodstream, and then carbon dioxide goes out of the blood to the alveoli, and then we breathe it out. Okay, does that make sense? So what causes COPD? Emphysema and bronchitis, like I said, are the two main ones. Emphysema is damage of the alveoli. So do you guys remember what the alveoli are? Those little balls in your little sacs of air in your lungs. And then do you guys remember where the bronchioles are? So those are the tubes right here that run off the trachea, and then the bronchioles. Okay. So bronchitis is inflammation of the bronchioles, okay? So those two kind of work together to cause COPD. So these are the early symptoms of COPD. A nagging cough, also called smoker's cough, shortness of breath, especially with physical activity, wheezing, and a tightness in the chest. Have any of you guys felt any of these before? Do you want to share your experience?
Usually when I'm coming up the stairs, I notice that before I can make it both flights of stairs. However, when I make it about one, that's when I have to stop and kind of hunch over to catch my breath. It's very difficult sometimes.
So, you know.
I know.
He knows. All right. So look out for these. These are early symptoms of COPD. As it progresses, you're going to see these things. So having trouble catching your breath or talking, blue or gray lips, or fingernails, trouble with staying alert, staying focused, very fast heartbeat, swelling in the feet and ankles, and weight loss. So if you're starting to see those things, your COPD could be progressing. Okay. How is smoking related to COPD? You, sir, would you like to read this slide?
The entire slide?
Yes, please.
COPD is usually caused by smoking. 8 out of 10 COPD-related deaths are related to smoking. It is the third leading cause of death in the U.S. It kills about 3 million people worldwide each year. Nearly 16 million people in the United States are hospitalized each year because of COPD. Smoking during childhood and teenage years can increase the risk of developing COPD in adulthood.
Thank you.
Makes sense?
It does make sense, right? So these statistics, I like them. So that's why I included them in this presentation. Because they're good to show you that, smoking leads to many medical issues. Okay, so that's how they're related. Here are your risk factors for COPD. So we've talked about the big ones, so tobacco smoking. Any of you have asthma? Way back there has asthma. Okay, sorry to hear that. So smoking, you're hitting two birds with one stone because you have asthma and you're smoking, so I'd stop. So tobacco smoking, smoking with asthma. Does anybody work with dust or chemicals in their profession? Anybody in here, you sir?
We farm.
You
so
farm, yes, yes.
Lots of pesticides.
Yes, it's true. What about you right there, well dressed, right there? No belt?
Yeah.
What do you do for a living?
I do drywall, so there's dust all the
Oh,
time.
yeah, that makes sense. So yeah, you're at risk too.
Yep.
Age, the older you get, the higher risk you are, and there's genetics play a part in it, so look out for that. Just look out, just something to keep in mind, look out for breathlessness, look out for nighttime symptoms, that's when they really act up in some people. And then in the morning is usually the worst time for COPD, so in the night and in the morning when you're waking up, that's kind of when to look out for it. And then we've already kind of talked about a lot of these symptoms of COPD, but just look out for these. This is just another refresher. Just look out for the cough or the shortness of breath. If you're getting a lot of respiratory infections, that's a big sign of it too. Fatigue, lots of mucus, just look out for those things. All right, so it has an impact on your family too. So what your family might have to do, if you get COPD or if you have COPD, they'll have to encourage pulmonary rehab. They'll have to help you with your meds. They'll have to attend the doctor's appointments with you, and they'll just have to monitor your condition. So it's going to have some impact on your family as well. Just look out in your family members. Look out for these things to see, if they're getting like too tired or they can't really handle or deal or cope with the problem anymore. So if they're feeling sad or they have a low energy level, trouble sleeping, if they're losing or gaining weight, if they're losing interest in things that they used to like, just look out for that in your family members. Can you guys do that for me? I'm going to be one of the people to encourage you to stop smoking. Do you guys all have that desire? You guys are here at this meeting, so I imagine that you do. And hopefully this presentation has taught you something about, avoiding COPD by not smoking. So quit smoking to prevent and treat COPD. And then these are just some meds that if you don't stop and you do end up getting COPD, you might need bronchodilators or steroids or phosphodiesterase 4 inhibitors. So you want to look out for that, so you don't have to take these. You might have to take antibiotics, and then if it gets really serious, you might have to have lung therapy, so oxygen therapy or pulmonary rehab like we talked about earlier. And then if things get way out of hand, you might need surgery to reduce the lung, you might need a lung transplant, or you might have to get, they're called a bowl. It's a bolectomy. They take the little bubbles out of your lungs if you get them. Okay? Do you guys have any questions?
No.
No.
You?